Hello, and welcome to today's current news. Today is March 28th, 2024. We will be listening to BBC. In Cleveland, mushrooms digest entire houses. How fungi can be used to clean up pollution. NPR. U.S. farms are making an urgent push into AI. It could help feed the world. And NPR. For patients with disabilities, this doctor prioritizes independence and fun. In Cleveland, mushrooms digest entire houses. How fungi can be used to clean up pollution. In the struggle to combat pollution and fight climate change, a growing number of scientists are beginning to look to one of nature's oldest biotechnologies, fungi. The city of Cleveland faces an epidemic of abandoned houses. Crumbling homes number in the thousands. These ramshackle structures are riddled with toxins like lead and dilapidated to the point of no return. And if tearing down and safely disposing of the waste of one such home sounds daunting, imagine thousands of them. Among the numerous issues that arise, one essential question involves waste. What do you do with the waste material from so many tear-down structures, when so much of it is toxic? All the material for demolition, the studs, the floors, cellulosic mass, the primary structural component of plants, and even things like ceiling tiles and asphalt material, like roof shingles, can be mixed into substrate that then becomes good for growing fungus, says Chris Moore, founder of Cleveland-based architect firm Red House Studio. Through his firm, Moore has been advocating for the use of substrate to address Cleveland's housing crisis, which is also a health crisis for the city's inhabitants. Substrate is any material that mycelium, the thready vegetative part of fungi, uses for nourishment. In other words, fungi can eat the noxious waste from the abandoned homes. Heavy metals and other toxins are extracted and captured in the mushrooms that grow, while the substrate leftovers, including the mycelium, are compacted and heated to create clean bricks for new construction. The resulting mycoblocks have a consistency akin to hardwood and, depending on the specifics of the manufacturing process, have been shown to be significantly stronger than concrete. This is Red House's BioCycler program, which is one of the most diverse efforts around the world aiming to eliminate pollution, combat climate change, and mitigate its already looming effects via one of nature's oldest biotechnologies, fungi. Effectively, what we're doing is diverting tonnage from landfill, says Joanne Rodriguez, founder and chief executive of a similar organization called BioCycle, which works to recycle construction waste for corporate clients, because 11% of the world's carbon comes from materials in the built environment. By 2027, just from BioCycle's waste diversion, Rodriguez anticipates carbon reductions of close to 160,000 metric tons. What else can mushrooms do? While digesting entire houses may seem like a mighty task for the humble mushroom, some species' ability to devour waste and eradicate pollutants, among other characteristics, means they present an oversized opportunity to extract harmful toxins from both our built and natural environments. Along the way, they may help to address a spectrum of additional ecological concerns. This is the emerging field of mycormediation, which researchers assert could also create a circular bioeconomy, in which less waste and contaminants are produced in the first place. Its applications are abundant. In Delhi, India, the hope is that fungi will help to clean the infamously polluted air. In New Zealand, mushrooms have been used to filter oil from a canal. Operating across Europe, the Life My Soil project has leveraged mycormediation to reduce total petroleum hydrocarbons in soil by 90%, spanning 3 pilot sites. The list goes on. As primary decomposers in the environment, many species of fungi are designed to break down complex carbon chain molecules like wood, composed of lignin and cellulose, says ecologist Brendan O'Brien, executive director of Co-Renewal, a bioremediation nonprofit. In order to do so, they produce enzymes to break the bonds of those complex molecules, he says. They are therefore often able to break down other persistent organic pollutants with similar chemical structures. Fungi have been observed breaking down pollutants such as petroleum, forever chemicals, known as PFAS, herbicides, and pesticides. By sequestering and immobilizing contaminants like heavy metals in their tissues, fungi can even help eliminate lead. These cleanup methods could prove a boon to ethnic minority communities who tend to be disproportionately impacted by environmental toxins. Research has shown a direct correlation between minority status and the presence of soil contamination. I think mycelium will be the unsung hero of climate change. Joanne Rodriguez. Co-Renewal works to develop and implement sustainable solutions to restore damaged ecosystems, from post-wildfire regeneration to cleaning up oil spills to reducing toxins in the built environment. The organization began with the mission of cleaning crude oil pollution in the Ecuadorian Amazon using oyster mushrooms, which are well known for their ability to break down petroleum and hydrocarbons. They shifted their efforts to post-wildfire cleanup in the wake of the Northern California wildfires in 2017, applying fungal materials to prevent toxic ash runoff from entering fresh waterways and regenerate ecosystems damaged by fire. Currently, they're testing the effectiveness of this treatment in 5 wildfire hotspots along the U.S. West Coast and expect to have results by early 2024. While the ability of some fungi to eliminate petroleum is well documented, there are numerous studies underway to discover what else these mysterious mycelia can do. Their impact on PFAS chemicals used in everyday items, such as cleaning products and waterproof clothing, have been found to negatively impact our health, has been more speculative. Until recently, in 2022, researchers at Texas A&M University have developed a technique that allows white rot fungus to successfully break down PFAS. Bioremediation is more sustainable and cost-effective than many other means to treat PFAS, says Susie Day, a professor of plant pathology and microbiology at Texas A&M University, and one of the researchers behind the study. For example, thermal destruction is commercially available, but it is very energy intensive. She points out that using heat to break down the chemicals can be more cost-effective, more condensed quantities for PFAS, but that bioremediation is more viable to be applied at larger scales. Now her team is searching for fungus strains that have stronger capacities to remove and break down PFAS chemicals. The elimination of these persistent, increasingly prevalent chemicals may prove to be beneficial to long-term human and environmental health. While the jury is out on precisely what risk PFAS pose to human health, animal model studies suggested that some PFAS may affect growth and development at larger dosages, says Dye. Other animal studies suggested health risks in reproduction, thyroid function, the immune system, and the liver. And as many contaminated soil, communities of color are more likely to be exposed to harmful levels of PFAS. The potential dangers have made the elimination of PFAS a priority among many bioremediation researchers. For another example, a research team at the University of Minnesota is currently putting together a scientific paper on its work to demonstrate that certain fungal species can defluorinate the harmful chemicals, which decreases their toxicity. The fluorinated carbon bond chemically is the strongest bond in the world, explains Ji Zhang, assistant professor of environment and industrial microbiology at the University of Minnesota. That's why it's so difficult to deal with. But our research, which is still preliminary, found that some fungal species can break down this resilient bond. That by itself is a fundamental achievement. Our next step is trying to understand the underlying mechanisms. As research continues, experts are confident that the potential applications of mycoremediation will expand. We've only scratched the surface and the capabilities of mycelium. I think mycelium will be the unsung hero of climate change, predicts Rodriguez. U.S. farms are making an urgent push into AI. It could help feed the world. American farmers are rapidly plowing ahead with adopting artificial intelligence. The technology is as sophisticated as it is essential. Standing in a lush green field in the American Midwest, a farmer points his smartphone at one of his soybean plants. He snaps a photo of a pest crawling a leaf. then lets an AI-driven program name the species of the bug and whether it's a cause for concern. Technology like this might sound like a novelty, but it is vital. Across agriculture, a dearth of workers is threatening the viability of the industry both in terms of profitability and crop yield. There simply are not enough hands to sustain the food systems that feed the world. This is particularly a problem in the US, which produces the third largest agricultural output behind China and India. One of the biggest issues is simple: farmers are getting older. Many can't take on the sun up to sundown manual labor needed to effectively run a farm. And while many of these operations may have been family run for decades, younger generations aren't taking the reins from their elders as they once did, instead opting for jobs in less labor-intensive, better-paying industries. The hired laborers who make up the rest of the agricultural workforce, largely immigrants, are following these patterns too. Labor is the number one concern, says Emily Buckman, Director of Government Affairs at the American Farm Bureau Federation, an industry trade association. The average age of a farmer is now 60. Buckman herself grew up in a farm in Kentucky, where her 70-year-old father still works the soil, only with her brother to help him. To solve the problem, especially the worker pool, it is not only thinning, but also getting more expensive, and crop yields are declining. Some U.S. farmers are looking to emerging robotics, and AI tools. We think about solutions to solving the problem, and we do think that advances in technology could help ease some of the labor load, says Buckman. Artificial intelligence in agriculture is not wholly new. Nascent iterations have been in use for 2 decades, like auto-steering guidance systems to row crops such as corn. But AI take-up in the past few years has been swift. According to some estimates, 87% of businesses in the U.S. agriculture industry were using AI in some shape or form as of late 2021. The federal government, too, is currently fast-tracking the agriculture industry towards the tech, providing financial incentives to speed up development and deployment of AI across the country. If the push to adopt AI across the nearly 2 million American farms succeeds, the implications for the rest of the world could be substantial. This is especially the case as the number of mouths to feed across the globe grows, and climate change threatens the agriculture ecosystems of some of the largest producers on Earth, including the U.S. itself, which exported more than $100 billion of products to China, Mexico, Canada, and Europe last year alone. The industry's goal is to develop and adopt new technology on a mass scale that is both affordable and accessible, so that farmers can feed the world, says Buckman. The world's population is supposed to increase by 2 billion by 2050, which means we're needing to grow 70% more food than we do now. Innovative technology is going to help us do that. A great deal of promise. There is a lot of pressure for the agriculture industry to provide solutions, and fast. The U.S. labor shortage has already forced these operations to do more with less, but the urgency of the climate crisis is the tipping point. Erratic weather has made it more difficult to predict growing conditions, and is also hurting crop yields. In other words, hotter weather could lead to less food sooner than expected. All projections show major losses in crop yields due to climate change, says Patrick Snabel, a distinguished professor at Iowa State University, where he directs the Plant Science Institute. A 10% or 20% reduction in corn yields could be catastrophic, he says. So the question is, can we use AI to increase resilience? Iowa State is home to the AI Institute for Resilient Agriculture, which works to create AI-driven tools and technologies with partner institutions across the U.S., and is supported by the National Science Foundation and the United States Department of Agriculture. Our focus is looking at 2 broad problems, says Schnabel. One is sustainability identification. How do you design new activities that are related to agriculture and resilient to climate change, he says. The second thing is, how can AI, robotics, and sensing tools enable more profit for farmers, less utilization of resources, energy, chemicals, and water? Bhaskar Gana, director of the AI Institute for Resilient Agriculture and a professor in the mechanical engineering department at Iowa State University, says that in terms of tackling those two goals, there's a great deal of promise, and some of it's already being implemented. Currently, Bugman says drones and GPS tools are the most widespread AI tools on the market, but there are many more too, such as self-driving tractors and combines, and even quality sensors on those machines that can help farmers determine which parts of their crops need more or less attention. There are also robots that can do automated sorting tasks that previously required a human eye. For instance, some farmers are leveraging AI tech to sort potatoes, looking for specific defects. Others are using AI-enhanced cultivators to plant seeds and remove weeds from fields, which can effectively replace dozens of human workers. Fertile soil for AI. Using AI to reduce the quantity of resources used while also improving crop yield is a part of a larger strategy experts refer to as precision agriculture. The idea is for farmers to use emerging technologies, say drones, that assess a field's water or pesticide levels to address problem areas with surgical precision. Precision agriculture helps reduce water waste, be more efficient, and do more with less, says Buckman. U.S. agriculture would have needed 100 million more acres 30 years ago to match today's production levels, she says. The production improvements are largely due to precision AG strategies being used in tandem with AI and other tech. Many of these advancements have been pioneered and deployed at scale by major players in the global agriculture space. Among them is Illinois-based John Deere, which develops and manufactures tractors and other tech tools for use in agriculture operations across the world. Our goal with AI and technology is to help farmers do their jobs better, says Sarah Schnickel, John Deere's Director of Emergency Technologies in the Intelligent Solutions Group. AI tools are changing farming. It's already here, and farmers are adopting it, she says. We see a future where more and more farmers are using this technology. For patients with disabilities, this doctor prioritizes independence and fun. For Missy in the stands, Kevin Carlson's eyes lock on a giant of a man straddling the top rope of the ring. Carlson, a self-described WWE wrestling junkie who has cerebral palsy, boos the reviled wrestler along with the other 15,000 fans who packed the arena in downtown San Jose, California. As the 62-year-old watches the giant fly across the ring, landing on top of his opponent, a respiratory therapist suctions Carlson's lungs, and a nurse checks his catheter. Carlson is here because his healthcare team snagged a row of wheelchair-accessible tickets, packed up extra ventilator batteries and oxygen tanks, and shuffled staffing schedules to free up 3 workers to accompany Carlson for the night. Holistic health care like this is rare among the country's 2 million adults with developmental and intellectual disabilities. Carlson's doctor, Clarissa Kripe, says this is what it looks like when healthcare does better by people with disabilities. If it takes money, effort, and importantly, the conviction that sometimes physical health takes a second seat to enjoy. Kripke's goal is to provide care that extends beyond medical transactions. Healthcare is about helping people to participate fully in their lives, Kripke says, not just about curing disease. A promise of less restrictive living for people with disabilities. 25 years ago, this June, the Supreme Court's landmark, Olmstead v. LC, ruling slammed the door on a dark era in U.S. history. Decades of states institutionalizing hundreds of thousands of people with disabilities like autism, Down syndrome, and cerebral palsy. Justice Ruth Bader Ginsburg wrote in the majority opinion that locking people away had denied them the pleasure of less restrictive living. Since then, the number of people in large state-run facilities has plummeted from nearly 200,000 in the 1960s to below 20,000 today. People with Down syndrome now live close to 60 years on average, compared to just 26 years in 1950. But according to the 30 sources Tradeoff spoke to, the freedom to live fuller and healthier lives remains elusive for many. one key culprit in the U.S. healthcare system. The evidence suggests that the patchwork of doctors, hospitals, and insurers that has replaced institutions as people's go-to source for caring is falling short, limiting people's independence and harming their health. Patients too frequently meet doctors and nurses who are untrained and uncomfortable caring for them, struggle to enter inaccessible exam rooms, and encounter insurers who deny their request for essential equipment. A limited but troubling body of research captures the system's shortcomings, showing that these patients are less likely to get preventative care, such as dental exams and mammograms, and are more likely to take avoidable trips to the emergency room. People with intellectual disabilities need to be treated and respected the same way that we do every other patient who shows up at the doctor, said University of Chicago public health researcher Harold Pollack. We are a long way from that. Kripke, a family physician and University of California, San Francisco professor, has devoted her career to blowing up the obstacles patients with disabilities face. Over the last 2 decades, in collaboration with partners like the advocacy organization, the ARC San Francisco, and the Health Plan of San Mateo, a county-run health insurer, Kripke has gradually reshaped care for adults with complex disabilities in the San Francisco Bay Area. The doctor has turned the traditional primary care model inside out. She's ditched the typical rushed 15-minute visits in cramped exam rooms and instead heads out to small group homes where her patients live. House calls, says Kripke, allow her to ask questions. How do you want to spend your day? Where do you want to go? What do you want to do? House calls and hidden work. Kripke has developed a unique way to deliver care, particularly for those with complex medical needs. She relies on staff in group homes. She calls them her eyes and ears, to monitor people's health and their progress on personal goals, like taking more outings or gaining life skills. It's a level of attention that requires follow-up and follow-through, or what the doctor calls hidden work. Coordinating with specialists or appealing insurance denials, Kripke estimates that for every hour of direct patient care, she spends another 6 on these other tasks, roughly triple what doctors caring for other types of patients spend. Rather than billing for every test she runs or calls that she makes, Kripke charges each patient's insurer or group home a flat monthly rate. She caps her patients list at 100 people, less than 10% of the lengthy roster a typical primary care doctor manages. Kripke's coach has paid off for Carlson. During a visit to his 5-person group home in Redwood City last fall, Carlson said proudly that his weight has climbed from a dangerously low 70 pounds to 111 since Kripke took over his care. Staff also slashed through insurer red tape to secure Carlson, a naturally gregarious guy, a speaking valve that helps him communicate with his ventilator. It's unclear if Kripke's model reduces spending. Her program has yet to be studied, but perhaps the clearest sign it's a good deal. Group homes choose to pay her fee when, instead, their residents could get treated at local clinics for free. Potentially, the longer Kripke keeps the most medically complex patients living in the community rather than an institution, the bigger the payoff. Carlson's group home, for example, costs Medicaid and the state of California roughly $27,000 a month, whereas the intensive nursing facility runs closer to $34,000. When problems land, people like Carlson in the hospital, as his kidney stones sometimes can, Kripke keeps a close eye on her patients' care there too, and believes that helps them get home sooner and in better shape. That theoretically could save taxpayer-funded programs like Medicaid and Medicare money. More training and a better pay structure could spread the model. Kripke estimates some 50 other doctors in the country are honing innovative models to deliver high-quality care to this population. She, herself, has trained thousands of caregivers, advocates, and providers. Yet, it will be difficult for approaches like hers to spread more widely without more training for frontline clinicians. The workforce lacks both specialists for people with the most complex conditions and primary care providers with the insight to respectively treat patients with disabilities. It's as hard today for adults with developmental disabilities to find attentive, loving, expert care as it was in the early 2000s when I was starting out, Kripke said. A recent national survey of physicians found just 4 in 10 felt very confident in their ability to provide the same quality of care to patients with a disability as those without one. Only about 15% of U.S. medical schools have joined a national initiative to bolster training. Without more pay, many clinicians may be reluctant to invest the extra time and training to do this work. A bipartisan House bill introduced in 2023, the so-called Heads Up Act, would boost certain payments for providers serving this population. Ari Neiman, who served on the National Council on Disability during the Obama administration, said scaling work like Kripke's requires both insurers and providers to make big shifts. We really need additional training, he said, and we need to ensure that pay is aligned with the amount of time it takes physicians to provide competent and accessible care to people with disabilities. New federal rules signal hope. Kripke's approach to focus on caring for adults with the most medical needs, a small slice of the broader disability community. New and forthcoming federal regulations aim to improve care and inch closer to delivering more independence for all U.S. adults with developmental disabilities. Starting last year, group homes began facing closer scrutiny over the amount of privacy and autonomy they offer residents, for example, locking their bedroom doors or setting their own schedules. Federal officials expect to finalize rules this spring that target discriminatory policies, like relying on the inaccessible medical equipment that still litters America's hospitals or putting people with disabilities at the end of the organ transplant line. It is critical that people be able to get in the door and that people be able to get on the table, said Allison Barkoff, who leads the Administration for Community Living at the U.S. Department of Health and Human Services. The lack of accessibility has been a huge barrier to prevent health care. People with disabilities can spend months, even years, wading through webs of approvals to get critical care, like more help at home or a new wheelchair. A regulation finalized this year to take effect in 2026 requires Medicaid and private Medicare insurance plans to make faster, more transparent decisions about whether they will cover these services. There's a wait list for everything. Better healthcare is one piece, advocates say. In their decades-long fight to help people with disabilities live more independently, what's also required is an expansion of wide-range services, from housing to help preparing meals. There's a waitlist for everything when you have a disability, said Melissa Crisp Cooper, who has cerebral palsy and works for the Arc of San Francisco. A lack of paid health aides who help people shower, shop, and get to work have led to fewer options. Because of low wages and a lack of respect, said Barkoff, we are at a point where the vast majority of providers are turning down referrals and even closing services. Between 200,000 and 700,000 people are waiting for at least one service they need to live in the community, and some data suggests Black and Hispanic people are hardest hit. Some family members and people with disabilities, and even doctors, frustrated by these resource constraints, insist that a return to a larger institution-like setting is necessary. That's just not true, said Kripke. Over her 20-year career, she has seen enough proof that people can thrive outside of big institutions, even patients with the most complex needs, like wrestling fanatic Kevin Carlson. People didn't know that could be done before, said the doctor, but now that they do, the onus is on policymakers and the healthcare system to make life freer and fuller for reality for all. Thank you for joining me today.